Thank you so much, Madam President, and through to the members. I want to first start by thanking the senator from Arlington for her tremendous efforts on this piece of legislation that we are taking up today. I also want to commend the chair of Ways and Means and all who worked on this bill, staff included, of course, and also thank the gentleman who spoke before me from Springfield for his efforts around persons with disabilities. And then the gentleman from Middlesex and Worcester District for his work on PBMs. There are a lot of great efforts being taken up here today, and this bill is certainly something we can all be proud of. I rise today in support of Amendment number 7, ensuring epinephrine injector access for children. The prevalence of life-threatening allergies among children is on the rise, and the CDC has reported that food allergies in children increased by 50% between 1997 and 2011. It's actually estimated that currently 1 in 13 children has a food allergy of some sort, and more than 40% of those children have experienced a severe allergic reaction. Food allergy is the most common cause of anaphylaxis. And although there are 8 food groups responsible for about 90% of allergic reactions, there are more than 170 different foods that have been reported to trigger an allergic reaction. Given the severity of anaphylaxis, we are fortunate to have the first line of treatment, epinephrine. As many of us are aware, the first modern epinephrine autoinjector, EpiPen, became the poster child, so to speak, for the drug pricing problem in this country back in 2016, with pricing increasing more than 500% over a decade. And I'm getting some feedback, Madam President, if I could just ask that the microphones are muted or we take care of that, that would be great. Thank you. Thank you, Madam President. One 2016 report found that the price of an EpiPen 2-pack increased from $106.32 in 2004 to $608.61 in 2016. Do we know what the cost of the active ingredient is in an EpiPen? About $1. $1. The auto-injector mechanism, which made EpiPen a household name, it's been in existence since the 1970s when it first was invented for use by the military. Now, the CEO and pharmaceutical giant Mylan, which manufactures EpiPen, Heather Brush herself, even stated, if EpiPen needed to be a catalyst to show the system is broken, then so be it. And the system has been broken for a long time, friends. In 2013, President Obama signed into law an act providing financial incentives to schools that keep epinephrine autoinjectors on hand. Mylan's response to the act was to restrict schools' access to competing autoinjectors, as few as there are. That's unacceptable. EpiPen has become synonymous with epinephrine autoinjector, similar to the way Kleenex is synonymous with tissue. The level of brand trust gave EpiPen virtual control over the epinephrine autoinjector market. And what those of us without allergies may not know is that even though the first generic epinephrine autoinjector was approved by the FDA 15 months ago, a 2-pack of generic can still cost $100 to $400, prohibitive for many working families in this Commonwealth, especially as high-deductible health insurance plans become more common. Mylan even produced its own generic version of the EpiPen priced at $300 for a 2-pack, an identical product selling at 2 different price points. We hear about this happening all the time. As adults, we have some measure of control over our surroundings. But for children, exposure to a potentially fatal allergen can be completely inadvertent. More than 15% of school-age children with food allergies have had a reaction in school. It is critical that epinephrine be made available for children with life-threatening allergies at all times and in all environments, at home, at school, with caregivers, to prevent needless and tragic loss of life. In effect, families need multiple epinephrine injector packs at any given time, compounding the cost. Additionally, due to the 1-year shelf life of the medication, it must be replaced regularly, regardless of whether it is ever used. And And this results in parents and caregivers keeping injectors past their expiration dates because they can't afford new ones. I know we all agree no child should have to die because a caregiver can't afford life-saving medication. Having epinephrine injectors in hand is but a small part of the additional costs caregivers face in raising children with food allergies. And based on the USDA's expenditures on children by families report for the year 2012, annual child rearing expenses per child for a middle-income two-parent family ranged from $12,600 to $14,700, depending on age. With added costs identified by a 2013 national study published in a pediatric study of raising a child with a food allergy, including caretakers, special foods, special safe schools, camps, and other activities, and opportunity losses at work for parents, these numbers climb to a range of over $16,000 to over $18,000, almost $19,000. That is a $3,500 or 30% increase in the yearly cost of raising a child. 30%. You can imagine the additional financial strain that places on lower income or single parent homes. This amendment I filed, which passed in the chamber during our last debate over the PACT Act, mandates that the Center for Health Information Analysis perform an impact analysis regarding the cost of providing epinephrine injectors to all children and report by June of 2022. I am grateful to the senator, once again from Arlington, and our leadership team for recognizing the urgency on these issues and working with me and all of those impact so that we may take one step closer to realizing the dream of providing epinephrine injector coverage for all children of the Commonwealth. I respectfully ask that this amendment be adopted. Madam President, thank you.
The question comes on adoption of the amendment. All those in favor say aye. Opposed, no. The ayes have it. The amendment is adopted.